Would the sponsor yield some questions for this particular area?
Yeah, Mr. President, Senator Rivera will be answering questions.
Senator Rivera, do you yield for questions?
Yes, Mr. President.
Sponsor yields.
I'm going to cover a number of different areas, Mr. President, if okay with you, but just to let Senator Rivera know we might bounce around a little bit. The first area has to do with the nursing home provider case mix proposed cut. And that, in the governor's original budget proposal, it was booked at, I think, an $122 million cut, and the Senate One House rejected this cut.
Through you, Mr. President, yes, we strongly did.
Through you, Mr. President, sponsor continue to
Does the
yield.
sponsor yield?
I do.
Sponsor yields.
Is the entire proposed cut to nursing home provider rates restored in this budget?
Through you, Mr. President, what we did, first of all, the original proposal, which would have been the original governor's proposal, which would have been disastrous to nursing homes all over the state, was rejected very strongly. And what we did, and it is based on, if you allow me, Mr. President, just a couple of technical aspects here. The way that currently the rates that are paid to nursing homes are determined by two dates in the year that are currently, that audits are done as to who the nursing homes are actually taking care of. Then depending on what the acuity, meaning how long these people are taken care of, the seriousness of their ailments, then the rates are determined. And the proposal was to actually resize this to do it in a completely different way, and there was a claim that there would be $122 million of savings. What we did, we pushed back very strongly in saying, look, we can certainly redesign the way that we determine what the acuity is in these nursing homes, but we are not going to guarantee you $122 million worth of savings. Particularly, Mr. President, because we want to make sure that the individuals that are being taken care of, as well as the facilities that take care of individuals, continue to exist. And so what we did is we right-sized the proposal so that now we don't know exactly what the savings will be, but it is very likely that once the dates are randomized, in other words, in other times, not just in these two dates of the year, the Department of Health determines what the acuity is in nursing homes all across the state, determines an average of what the acuity is and determines a rate, then the rate will probably vary, so there will be some savings, but certainly the 122 that was originally proposed, we pushed back strongly because it would have destroyed the sector.
Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr.
Sponsor
President.
yields.
Regarding the same area, the One House proposed convening a work group. Is that work group in place in the final budget, and will there be an ongoing look at this or a formal look at this?
Through you, Mr. President, yes, this work group made it to the final proposal in the budget.
Will the sponsor continue to yield?
Sponsor yield.
Yes.
Sponsor yields.
Yes, Mr. President.
Do you believe nursing homes are operating at very thin margins? Many are operating at a loss. Do any of these potential, we'll say, cost savings to the state, but an ultimate potential cut, do you think that the nursing homes will be able to withstand this and still continue to provide necessary services?
Through you, Mr. President, yes. And the reason for that is that I believe that what we did was to push back very strongly on the executive and say to them that if we're going to, that this claim that was made by some that maybe nursing homes were lying to the state about what their acuity actually was, we're going to determine what the acuity actually is so that we're going to pay you more accurately in reference to who you're taking care of and how long they're being taken care of, et cetera. But we believe that once it is right-sized, that since it's going to determine, it's going to be more accurate, so it's going to determine the actual case mix of that particular nursing home, then it should serve to maintain that nursing home. And trust me, I know very well, and I'm sure that all of us have heard from nursing homes all across the state that reached out to our offices and told us how important it was that we get this process right. I do believe that we got the best possible outcome that we could have, because again, the original proposal was just madness. I'm glad that we were able to right-size it and make sure that we have something in line that can both save the state some money, but more importantly, maintain the people that are getting taken care of so that they're taken care of.
Thank you. Will the sponsor continue to
Does the
yield?
sponsor yield?
Yes, Mr.
Sponsor
President.
yields.
If we go back in time when the governor proposed his original budget, and originally the Medicaid spending was essentially consistent with the global cap, his 30-day budget then cut a number of things. Can the sponsor, just from the 10,000-foot level view, provide, could you go over the things that have been restored that the governor had proposed dialing back in his 30-day amendments?
Through you, Mr. President, I certainly can. It might be a long list, since that 30-day
Yeah,
was very
if
much...
I may, Mr. President, I'm really looking at the significant cuts to Medicaid from the biggest down through the ambulance, rather than me asking for 18 different line items. But we don't really need to go below the dollar amount for the rural ambulances.
And through you, Mr. President, that is precisely what I was about to say. That if we were to take some time to talk about every single thing that 30-day amendment did, and what we ultimately restored, it would take a long time, but some very important parts of that, we were able to restore $550 million in Medicaid cuts, which, as you know, Mr. President, would actually amount to $1.1 billion that would have hit the state in cuts. This includes $222 million in a clawback from rate increases for hospitals and nursing homes, $138 million for indigent care pool payments to certain hospitals, and $190 million across the board rate cuts. So these are, again, the 10,000-foot, but I can assure you there's a whole bunch of other ones that we were able to restore. And I should tell you something else through you, Mr. President. This was an incredibly challenging budget year, which you will hear again and again during today. One of the things that, just to get a comparison, Mr. President, last year, the table target for our particular table, for the health table, was $70 million. And the cuts that were proposed by the governor at that point amounted to less than $30 million, which means that even if we had bought back everything, and obviously the majority was the one that was taking care of the budget at that time, but even if we bought back everything, we would have more. We have more than half still left. That was not the case this year, Mr. President. It was only a $30 million table target. And when we consider, for example, that the city of New York, there was a cut in the 30-day amendments, which sadly we could not purchase back for Greater Public Health Works program, which amounts to a $27 million cut. We were not able to purchase that back. So we wanted to make sure that the big things, like again, this $222 million for hospital and nursing homes, $138 million for the indigent care pool, and $190 million across the board rate cuts, we got those back. So we were able to do that, and we tried to be as judicious as possible, spreading it across the state, and what we were able to restore. We were not able to restore everything, but quite a bit, Mr. President.
Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr.
Sponsor
President.
yields.
One other area where there was some cuts, and I want to make sure that there was restorations in the area of SUNY hospitals. Was funding restored for all the SUNY hospitals?
Mr. President, through you, Mr. President, that was actually not done through this table. It is at the higher education table, since it is SUNY, obviously it's SUNY Hospital, so State University of New York institution. It actually would be through that table that it was restored.
We can follow up at that when that bill is before us, Mr. President. Will the sponsor continue to yield?
Yes, Mr.
Sponsor
President.
yields.
Yeah.
Regarding safety net hospitals, the enacted budget, I believe, provides $41 million for the safety net hospitals, many located in New York City. And over the years, we've tried to secure funding for critical access hospitals located in rural regions of the state. Whenever we were discussing safety net hospitals, we tried to take care of both general categories at the same time. And my question through you, Mr. President, is there funding not only for safety net hospitals, but the critical access hospitals across the state?
1 second, Mr. President. One second, Mr. President. I want to make sure that I get the answer correct. Through you, Mr. President, to thank you for your patience, first of all. It was ultimately we pushed the governor to include in the executive budget, there was a pool of money that was included for safety net hospitals. We actually included $60 million for enhanced safety net hospitals. Again, this was a very tough budget year, but there was also the executive included. We're going to get you the exact number, but there was something that we managed to get the governor to put back in the final in the final budget agreement. Through you, Mr. President. Yeah. Yeah.
President, I did have a follow-up, but I'll hold off on that until we get additional information, or I may have a follow-up.
Does the sponsor continue
But
to
will he
yield?
Yes, I
continue to
continue to
yield
Yes.
for
yes.
additional
He
questions?
yields. Sponsor yields.
So regarding healthcare transformation funding, the Senate One House budget strongly advocated that funds in the Healthcare Transformation Fund be used to fund commitments made by the executive to support healthcare delivery in the state. Does the budget, what is proposed right now, specifically restrict funds held within the Healthcare Transformation Fund to only support healthcare program delivery? Or is this funding still projected to offset non-health related programs such as housing rental subsidies?
President, yes, we managed to get that back. This is I referred to it earlier. This is the $220 million clawback from rate increases from hospitals and nursing homes. I believe, Mr. President, that the senator is referring to the fallout is not the right term. It is when we sell something, we get something back from it. It's going to come to, what's that?
Yeah, that was
It'll come. The word will come to Mr. President, but it just basically means when Fidelis was sold, there was a chunk of that money that came to the state, and there was a promise that came from the state related to hospital and nursing homes rate increases. That was taken back in the 30-day amendments, and then we managed to get it back for the final proposal, for the final budget that is in front of us.
Thank you. Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr.
Sponsor
President.
yields.
I have two more areas. One, I think, is an area that's important to every member in here, and then, of course, their constituents. And it deals with consumer-directed personal assistance program in the fiscal intermediary proposal. How does the proposal before us today regarding this CDPAP program differ from the executive proposal?
Through you, Mr. President, I'm very glad that the senator brought this program up. I am sure that all of us across the state have heard from our constituents, both people who are served by the program and people who take care of people who are served by the program. This was a program that was not only started in New York State, but we feel very strongly in the majority, and I know that this is something that we share, that you folks share across the aisle. We wanted to make sure that if there's any changes in the program, that the people who are taken care of, the clients, if you will, are at the center of it. The consumers are at the center of it. So there was, in the original proposal, it was basically a grenade, if you will, thrown into the middle of the program, and it would have basically destroyed the whole thing. We went in there very strongly, Mr. President, saying that this was a program that needed to continue to exist. It is incredibly important. We need to protect these individuals. And so what we did is we managed to redesign the program as it refers to the fiscal intermediaries. These are the entities that make sure that the individuals, be it family members or other folks, neighbors and what have you, who take care of the consumers, actually get paid. But as we know, Mr. President, the fiscal intermediaries don't just hand over a check. There's other things that they do. So what we ultimately did with the three-way agreement that we were able to secure, we made sure that, recognizing that the importance of the issue, we fought back and we made sure that the final proposal before us actually redesigns the fiscal intermediary so that there will be a mini bid process. This is the Department of Health will select the fiscal intermediaries to continue the program on a mini bid process that will be based on criteria that will include but not be limited to geographic distribution, cultural and linguistic competence, the ability to provide timely consumer assistance and consumer peer support, and compliance with all wage and labor laws. And we also created a stakeholder work group that will determine best practices to make sure that the program, as it goes forward, continues to exist and continues to thrive. Bottom line, Mr. President, was we felt that it was that this program is way too important to allow it to have been blown up as the proposal, the original proposal, or certainly the 30-day amendment proposed to do. I feel very strongly that what we were able to achieve, and our staff were warriors in there. I have to look at them directly and say, you are warriors in there. Fought to make sure that the people who are ultimately served by this program were served well and will continue to be served well.
Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr.
Sponsor
President.
yields.
When the governor proposed the changes to this particular program in looking to significantly reduce the number of fiscal intermediaries, one of the things that he had proposed was that anybody that was in business sometime prior to 2012 would be grandfathered in, but nobody else, anybody who came into business or was certified after that date would not be included. My question is, through you, Mr. President, does the proposal before us now include any such language regarding when somebody started in the business?
Through you, Mr. President, first of all, in Part G of this of Bill 1507C, there is language that includes. I will read some of it, Mr. President. As far as fiscal intermediaries complying with this section, including but not limited to entities that A, are service center for independent living under Section 1121 of the Education Law, or have been established as fiscal intermediaries prior to January 1st, 2012, and have been continuously providing such services for eligible individuals under this section. Now, for new fiscal intermediaries, or I should say, the process that I described earlier, this mini bid process would be a kind of a streamlined bid process, because each one of these fiscal intermediaries, Mr. President, would require a contract. So this streamlined process would consider the criteria that I already discussed, as well as criteria that would be further established by the work group. And I should also mention, Mr. President, that this is not going to go into effect until January 1st of 2020. Furthermore, we created a window of 45 days so that if there is a fiscal intermediary that is currently serving someone who is getting paid to take care of a consumer, and that fiscal intermediary is going to go out of business, there is a 45-day window where they have to make sure that they communicate with the individual that is providing the service. And this is to make sure, Mr. President, that there is continuity of service between the individual. So the individual is getting served now. The person who is serving that consumer is getting paid now. We want to make sure that if there is a switch in the fiscal intermediary, that can happen without impacting the services that are being provided.
Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr. President.
Sponsor yields.
Does the sponsor have, through you, Mr. President, does the sponsor have confidence that there are protections in place to ensure that the Department of Health won't simply deny applications of eligible fiscal intermediaries just simply to cut numbers or to save money?
Through you, Mr. President, that's a very important question. And I can tell you that not only through the process that again, these warriors went in there to make sure that we established, but also as it goes forward, there's many of us that are going to be keeping very close eye on how the process is actually undertaken. The work group that will be created with this proposal, as the stakeholder work group, will include people who are knowledgeable in the areas that will be knowledgeable in areas that are important to determine how best to establish best practices, et cetera. And they will, and I figured that these individuals will take very good care of making sure that the criteria that is created, so that ultimately those people who are chosen as fiscal intermediaries can continue to serve in the best, with the best interest of the consumer in mind. But it is, I should tell you, it was challenging to push back on the idea that the Department of Health needed to have sole authority, but we did so. It was not as far as many of us would have liked, but we did push back and say that even though the Department of Health and the Commissioner of Health has the ultimate authority, they have to operate within the criteria that we have set, so that we, I believe, did as much as we could to make sure that this would not be a process that would be driven just by whim, and instead would be driven, as I've said many times and I will continue to say, with the consumers at the center of it.
Thank you. Will the sponsor continue to yield?
The sponsor yields.
Yes, Mr. President.
Sponsor yields.
So staying with the same particular program, but moving over to the payment method. And we were, of course, in our conference committees, and we learned that just this Wednesday, Department of Health released emergency regulations changing the payment method, especially for this, establishing a per member per month reimbursement methodology for this particular program. Does the proposal before us today include that type of payment? Have those proposed regulations been dialed back until there's a look at this through the work group? Okay. And finally, I guess what I really want to know is, what's the payment method? Is it still the same, or is it automatic, executive making a decision, disrespecting the legislature, all these consumers, and imposing his will on a very good program that's so important to people with special needs?
1 second. What you're referring to was a notice that was put out on March 27th, just a few days ago, as we were kind of surprised by it as well, but after looking at it closely, a couple of things. First of all, this is the type of notice that is needed you need to put this out so that you are basically, it's a placeholder for what ultimately would be agreed upon. So the payment method that was agreed to, which is included in the final language, created a three-tiered system where basically there would be 3 tiers of payment depending on the amount of time of hours per month that the particular consumer is served. So it would be anywhere from an hour to 159 hours per month, which would be 1 to 4 hours per day, which would start at $64 per member per month, and goes all the way up to 16 to 24 hours a day would be $522 per member per month. So again, there is an agreed upon tier system that is included in the language. What you're referring to was a notice that needed to be put out there as a placeholder, but what was in there, it was ultimately what we negotiated, which is right here.
Thank you. Will the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr. President.
Sponsor yields.
The governor had proposed that if certain conditions existed regarding tax revenue, and in other cases some other items come up, and he's done this in the past. This particular year, though, governor proposed that if certain criteria was met, that the budget director, or the executive through the budget director, would have sole discretion to lower reimbursement rates for Medicaid to the tune of a total of $190 million. The governor's complete discretion in this area without consulting the body. And my question through you, Mr. President, is this in the final budget before us today? Or something to that effect?
You, Mr. President, I, like you, I should say, Mr. President, like Senator Gallivan, and maybe you as well, Mr. President, I'm certainly concerned with all the areas, not only in this budget, but certainly in any budget that I've ever seen as a senator here, where the executive kind of grabs more power for itself. I should say that in this case, that language ultimately made it to the final version. This refers to cuts that may happen at the federal level in October, that refer to disproportionate share hospitals or DSH cuts. If that happens, what the language states is that the executive could unilaterally make changes to the budget that would potentially result in a $190 million cut to our health system. That would be truly awful, and it would be in response to the awfulness that is already occurring from the federal government. So in this one, we ultimately left it in there. We do believe, I do believe that there is some leeway that the executive should have to act when an emergency occurs. This would certainly qualify as that if it happens in October. But like you, well, Mr. President, as Senator Gallivan also kind of stated as an underlying thing in his question, I am certainly concerned any time that we give more and more authority to the executive. But in this case, Mr. President, it did make it to the final one, and it probably, I'm hoping it's not necessary, Mr. President.
President,
Senator Gallivan on the bill.
I'd like to take the sponsor for taking the time to answer the questions and provide us with very important information, with information in an area that's so important. The biggest area, along with education, of spending in the budget, and probably among the most important things that we do. It touches so many people, and so many people who can't care for themselves are dependent on us to make the right decisions regarding funding for their particular programs. And I'm very pleased that I know all of the members in the chamber, both in the majority and the minority, were concerned about the governor's proposed cuts. It was very concerning. I'm pleased that through the advocacy of so many of our constituents, members on both sides of the aisle, that the bulk of these Medicaid cuts were restored. I have concerns about the viability of our nursing homes. Some questions going forward leave their future as a question mark, and it's something that I'm pleased that Senator Rivera, the chair of health, has pledged to keep a keen eye on so we can ensure that they are properly funded. The CPAP program is extremely important. It was very disturbing, as Senator Rivera indicated, when the governor put forward this proposal. I remain concerned. I have full confidence in Senator Rivera's commitment to ensuring the viability of this program. Look forward to working there, but I think that is an area of concern in this particular budget that we should all have. And then the final area was the last one that we spoke about that I think is always concerning, not just in this area, but anywhere where some would look at us ceding our authority to the discretion of the governor and the budget director to just go and make unilateral decisions without our input, and it's something for us to keep an eye on. But I am concerned about the potential of the governor pulling back up to $190 million in spending. Obviously, of course, if the negative things happen to the economy, if they reach those various metrics. But I think those are areas to be concerned about. I do thank Senator Rivera for his answers, and I too would want to acknowledge the staff that works on this, both in the majority and the minority side. It's such an enormous area of the budget, and there's much there, much for all of us to continue to be concerned about. Thank you, Mr. President.
Senator Serino.
Thank you, Mr. President. I have a few questions on health and aging because they kind of fall in the same pot, but I think I'll start with the question on Lyme, if I could.
Would this sponsor yield?
I would, with one clarification, on aging issues,
Yep.
the Senator May, being the chair of the Aging Committee, would be the best person to answer. But if, Mr. President, through you, if it is a health-related, something that is a health-related matter, I'd certainly be more than willing to yield.
Great. All right. Thank you. Thank you, Mr.
Sponsor
President.
yields.
Thank you, Senator Rivera. In your one-house budget, you included $1 million for Lyme and tick-borne diseases. Have you kept that appropriation in this final budget?
Through you, Mr. President, could Senator, could you repeat the last bit of your question?
Have you kept that appropriation in the final budget?
Through you, Mr. President, yes. Yes.
You have?
Mr. President, again, this is why you surround yourself with people that are smarter than you. There is no, that specifically for Lyme and tick disease, there's not there. What we ultimately included was it $2 million for like the public health one? So, Mr. President, through you, the answer to the senator's question is no.
Will the sponsor continue to yield?
Yes, Mr.
Sponsor yields.
President.
Sponsor yields.
Can I ask you why it wasn't included?
Through you, Mr. President, as I discussed earlier, ultimately the choices we had to make were very tough. This is, in the case, one of the things that I discussed earlier when the question was being asked about what our table target was this year, how much money we had to buy back the immense amount of cuts that were to the budget. For example, there was just not only the $550 million cut to Medicaid in all these different chunks that I discussed earlier, but the $75 million cut to the CDPAP program, the $122 million cut to the nursing homes, and then there was a myriad of cuts to different public health programs across the state. We were only given 30 to buy all of that back. And I should point out that while we did we did put something for school-based health clinics, we managed to get something for eating disorders, for community service elderly. So we tried to do things that were actually impacting as much of the state as possible. Thanks to the help of the Assembly, we were also, for example, able to put it in $150,000 for the Breast Cancer Coalition of Rochester. I know that Senator Helming, through you, Mr. President, cares deeply about this. As well as we tried to do as much as we could for rural health across the state. We put for rural health care access development, we put in $550,000, as well as for the rural health network development, we put in $550,000. We had to make some tough choices. Unfortunately, there are some things that we could not do. One of those was the $1 million for Lyme and tick-borne disease. Another one, as I mentioned earlier, was a $27 million pot for the city of New York that ultimately amounts to a $54 million cut, since it is Medicaid money, for the Greater Public Health Works program. So we tried to be as judicious as we could across the state. It is unfortunate this is one of the things that we did not ultimately include in the budget proposal, Mr. President.
Does the sponsor continue to yield?
Does the sponsor yield?
Yes, Mr. President.
Sponsor yields.
And Senator, I don't know if you're aware of some of the programs that the $1 million, last year we had $1 million. Every year we've kind of built that up for the past 4 years. But we've given money to the Kerry Institute, Cornell, Stony Brook on Long Island, and like right now the Kerry Institute, I think it's $190,000, which is really nothing when you think about it, but it's a lot to them. They're doing the Tick Project, and the Tick Project is through a variety of neighborhoods, and they're trying to see what works to get rid of the ticks. I was reading an article today that said that instead of making May Lyme Awareness Month, that we should make it April because of the increase in ticks. So I just wanted to see if you were aware of that financing going towards those really critically important programs, and it would be such a shame to not see that continue, especially when I know I have sick people coming in to see me all the time, whether it's an adult that used to have a business and is walking with a walker and they have no memory. It's affected their brain. Or the fourth graders that have come up here and said, hey, Senator Sue, I have rheumatoid arthritis, arthritic in their hands. Like, that's unbelievable. So this small amount of money, when you think about it, in a $175 billion budget, is so important. And budgets are about priorities. So I didn't know if you were aware of those programs that we helped fund for education, prevention, and research.
Through you, Mr. President, I was aware of some of the programs, not all of them. And through you, Mr. President, I certainly feel that obviously this is something that's very serious for Senator Serino and certainly very serious for many New Yorkers across the state. What I can tell you is that we did provide some money to the health department. We hope to work with the health department to actually make sure that some of these programs continue to exist. It is unfortunate that we were not able to fund them at the levels that we would have wanted. The reality is that we had to do in most programs in Public Health Works just being one of them, that was a total cut of 27 million. But basically across the entire state, we had to cut most of them. I would tell you, it was an incredibly challenging budget year because this is the budget that we were given by the executive. We had to abide within the parameters that were there. And I certainly was scratching my head as to why some of the cuts, for example, that came in the 30-day amendments came. I wish that we had more to do more money to be able to distribute. The reality is that we do not, and I believe did the best that we could. It is not that we don't care about these programs in the majority. It is unfortunately we had to make some very tough choices, and this is what ultimately we decided to do. Through you, Mr. President. I'm sorry, Mr. President. Thank you for pointing again. The Warrior Queens continue to prove themselves incredibly valuable, and I was just reminded of something, Mr. President. In the One House budget bill that we did, we actually funded Lyme and tick-borne diseases at a level of, was it? We actually restored 1 million in our One House. When we go downstairs, though, then that's when the things get interesting. When the Assembly doesn't match us, Mr. President, and the executive resists us, then we have to make some tough choices. So ultimately, the three-way agreement that we were able to reach was what we have in front of us, but I did want to, again, thank my staff for reminding me. We actually, knowing the importance of it, funded it in our One House budget. Ultimately, did not make it into a three-way agreement.